All right, we are live.
Great, and thank you for joining us. Thanks for watching this back. My name's Sam. I'm from the International Office at Manchester Metropolitan University, where I'm Regional Development Manager for India. And it's my pleasure today to be joined by a colleague from our physiotherapy department, Dr. Smarak Mishra, and we're going to discuss today some of the advantages of studying physiotherapy in the UK, what that means, what it's like, and also what it can lead to afterwards. So what are the opportunities that that can create? So I'll turn now to our guest today, Dr. Smarak Mishra. And Smarak, would you please introduce yourself for our viewers?
Sure, I will. Thank you very much, Sam. As Sam mentioned, I'm Smarak. I'm one of the senior lecturers here at Manchester Metropolitan University. And my background is basically I'm a physiotherapist and I did my master's in sports medicine. And then I've done two more masters, an MBA as well as an academic practice, still undertaking my PhD program. But I'm the department international lead. So I deal with everything international within our Department of Health Professions. So without wasting any more time, I'm just going to share a quick presentation. I've got no intention of killing you by presentation itself. So this session is going to be quite interactive in the sense I'll be answering some of the questions, and also we have a student, Kokila. I'll introduce her just shortly. So let me share the screen and then we can start with this little presentation. Right. So my name is Smarak Mishra, and as I said, I'll be joined by Kokila, and today we are going to kind of cover about the MSc Advanced Physiotherapy program and MSc Sports and Exercise Medicine program. We are covering these two programs specifically because these are quite relevant to physiotherapists who have an undergraduate degree in physiotherapy. We have other physiotherapy programs such as undergraduate physiotherapy and pre-reg postgraduate physiotherapy. Now, there is a lot of confusion when you go to the website because sometimes you see that there is a pre-registration physiotherapy. Let me clarify that that's not meant for qualified physiotherapists. So the ones you're looking at, which are important for a qualified physiotherapist, would be MSc Advanced Physio and MSc Sports and Exercise Medicine. So here are my details.
Can I ask you just to introduce a bit more about yourself, about your background in India and the UK?
Oh, sure. Thank you. Thank you for reminding, Sam. My background, I qualified from National Institute of Rehabilitation Training and Research. That's one of the three national institutes in India. And in 2000, it's a long time back. And after that, I started working in MGM Medical College, Indore. So I worked there for a year, then joined my master's in sports and exercise physiotherapy and medicine from Guru Nanak Dev University, that is in Punjab. And I qualified with the master's degree in 2003. So since then, I worked in Indore back again as a principal over there. And in 2006, I moved to Manchester. So my background has always been sports and exercise physiotherapy and musculoskeletal. So if you've got any questions about cardiorespiratory, don't ask me because I'm not an expert in that area. But in the UK, after joining in 2006, as you can see, I have worked here for nearly 14 years in the same place. I have been involved mostly with internationalization work, and as well as teaching a lot on the musculoskeletal and sports physiotherapy elements.
Thank you. And I guess viewers watching this will be spending their time to watch this for different reasons, but everyone's going to have some interest in physiotherapy, studying physiotherapy and the UK. So I guess the question is, why should somebody think about investing their time and energies into studying physiotherapy in the UK specifically?
Yeah.
Do you have an answer for that?
Yes, I would try to give an impartial view because I have studied in India as well as in the UK, and I kind of see the difference. And I've done a master's degree in India and a 2 master's degree in the UK, I would say that it is very different. In India, the concept of a master is that you learn some bits in undergraduate program and you learn more bits in the master's program. Over here, the concept is that you're learning more, obviously, but it is a lot about critical appraisal and then synthesis. So you are learning about how to bring in literature to enhance your practice. So we are not just thinking about giving you information, but enabling you to process information so that you can use it in your own way in your practice. So there's a lot of emphasis on evidence-based practice. That's principally the reason why I would suggest students from India, physiotherapy students from India, to think about studying abroad and specifically in the UK.
Thank you. And you've talked about some of the main differences as well there between courses in the UK and India. We do see a lot of demand, and for many years we've had many students, many successful alumni as well coming from India. Why do you think it is that the courses Advanced Physiotherapy and Sports Exercise Medicine, why are they so popular, especially with students from India?
Yeah, I must say that we started recruiting students from India back in 2009 itself. So we have a long track record of getting students from India. Now, because I have supported students from India particularly, I can say for sure that they come to the UK and particularly Manchester Metropolitan University because of the wide range of units we offer. If you haven't seen the range of units we offer on the master's program, you will see that there are more than 24 units on advanced physio and more than 11 units on the sports and exercise medicine program. So essentially, you can almost customize as to what you want to learn. Again, to compare with India, you have got specializations such as musculoskeletal, neuro, cardiorespiratory. But if you go into musculoskeletal, you can't do anything with neuro or anything with cardiorespiratory. Here, we kind of open up the whole range. And then we have got specializations such as manual therapy, musculoskeletal, neuro. But then within those also, you have got some opportunities, some options to branch out and learn about things that you would not otherwise learn in courses in India. So other things to add to that is we have got some very innovative units such as leadership, which is not covered much at all in India. And we have got units such as physical activity and health, which is a big part of physiotherapy in prevention nowadays.
Thank you. And I guess for the viewers, it's very complicated because there's so many units, as you said, such a range. Are you able to give a bit of an overview of how is the course structure of the courses?
I will certainly do that.
Such as the mandatory units and specialization.
Exactly. So essentially, our program is 180 credit. Now, if you're not certain about the credit system, then it might be a bit confusing. So let me try to explain that to you. So out of those 180 credits, our first unit on the advanced physiotherapy program is research methods, because we want all our students to be comfortable with understanding different aspects of research methods. So that's a mandatory 20 credit unit on the advanced physiotherapy program. And the last sort of bit is the project, which is also mandatory. So this is where you take up a project, and it could be a systematic review or it could be some data collection and analysis, but that's 60 credits. So that's take away 80 credits out of your 180 credit. That leaves 100 credit as options. Now, if you are doing a musculoskeletal route, you have to do at least 60 credits of those 100 in musculoskeletal. Then that means that you have to do at least 3 of the musculoskeletal units. Then you are free to do the other 2 units out of the range that is available. In manual therapy, however, it's slightly complicated because you have to do 80 of their units, 80 credit of their units, so 4 of their units, and you're left with just one option. Neuro, you have to do again 60 credits, and then outside that. But we also have a generic master's in physiotherapy, which means that you can pick and choose any unit you fancy. So it's we have kind of looked at the different range. At the moment, we are not providing cardiorespiratory master's route. That's specifically because our expertise is not in the area, but we are providing a sports route now in MSc Advanced Physio. Going on to MSc Sports and Exercise Medicine, it's slightly better in the sense that you don't have that many choices, but you still have to do your project, which is 60 credit. But the mandatory unit here now is going to be exercise physiology, okay? Because we all understand exercise physiology is a key component of sports and exercise medicine. So instead of research methods, we have got exercise physiology as the mandatory unit. Then you have got 5 units to choose in between, which can range from things like radiology in sports, sports physician, maximizing sports performance, rehabilitation in sports, and other sort of units such as musculoskeletal medicine, upper and lower quadrant. So again, in sports medicine also we have got a range, but it's slightly less than in advanced physio.
Thank you. So I'm getting there's a big range of choices, and students can sort of pick and mix many of their units to design a tailor-made physiotherapy program, or there's the sports exercise medicine program that you spoke about as well. In terms of the MSc Advanced Physiotherapy course, with so many specializations, how does a student choose what is the right specialization for them? And also, what are the popular specializations at the moment?
That's a very good question. In fact, I must say, with all my applications from India and all the candidates I interview, the students are fairly clear about what they want to do, because while doing their undergraduate physiotherapy program, they would have developed their interest. I must say 80% of physiotherapy, generally speaking, is musculoskeletal and orthopedics. So that's a definitive choice for many of our students applying from India. And that's where our strength lies, because if you think about all the professors, like Dr. Michael Callahan, Chris Littlewood, and Professor James Self, these people are world-renowned in their research in osteoarthritis, patellofemoral syndrome, and many other musculoskeletal conditions. So I would say about 80% of our students' choice is musculoskeletal, but we do get neuro because we have got very good neuro expertise as well. Sports is another very popular choice. Sometimes students get confused between musculoskeletal and sports because they can't decide. Some are very keen on sports, some are very keen on musculoskeletal aspect. But I would say that we would help you with your choices. Once you join on the program, on the induction, your program leaders will speak to you about the different choices. And although you may have some preconceived ideas about what you want to do, the choices might change upon discussion with your program leaders.
Thank you. So I'm guessing there's a real range of choices, and they're taught by experts. Are they theoretical? Are they practical? If I'm coming to study MSc Advanced Physiotherapy or Sports Exercise Medicine at Manchester Met, what can I expect? Is it going to be a theoretical education, practical education? How is it?
Yeah, again, a very good question. Now, physiotherapists are generally hands-on sort of students. They want to learn by seeing and learn by doing. So accordingly, most of our units are practically based, but there would be theoretical modules as well. For example, if you are doing musculoskeletal medicine, upper quadrant, lower quadrant, or manual therapy, those would be very hands-on. You have to do hands-on to learn those effectively. But if you're doing a unit such as physical activity and health, or chronic pain management, or let's say you're doing a unit on leadership in clinical care settings, then these would inherently be theoretical. As you know, it all depends on the units you choose.
Thank you very much. And I should say that viewers can visit our website and see a lot more detail about the program and see the different units, and they can stay in touch with Dr. Mishra and the physiotherapy department during the application process to hear much more and to work out what's the right choice of units to study. We also are very lucky that we have a team based in India who are there to help you as you're trying to make your decision. And you can contact our India team. You'll meet Prachi Hajila later, who's the manager of our India team. And you can reach them in a number of ways. We've got great social media, Facebook, LinkedIn, but the easiest way is probably by email, india@mmu.ac.uk. So that's a quick way that you can ask any question. So after you've watched this and you have some further questions, please get in touch and we'll help you there. Just one question I've got in terms of supporting students. What support can students expect during their studies themselves? And also maybe if you could answer, how challenging is a master's program in the UK?
Yeah, I think I'll flip the questions in terms of the order. In terms of challenge, I think it is fairly challenging. You will find it not so easy, but you would not either find it very, very difficult, extremely difficult either. Given that we kind of scrutinize your application and we do the interview, we kind of have a general idea as to what level of student you are. So we only take the ones who we think are going to be successful on the program. So the challenge is the cultural difference in terms of learning. In India, it's a lot of didactic learning where the teacher is the expert or the lecturer is the expert and they give the information and students are supposed to absorb all that information. We think that passive learning doesn't do much good to the students. It does lots of wonders to the teacher because they have to learn, but not to the students. So we emphasize a lot on active learning. So essentially, we'll say, okay, this is the case study, and we'll divide into groups and we'll say, okay, now you have to work on the case and find out what are the main problems and how you can solve the problem by integrating research-based evidence. We emphasize a lot on research-based evidence because we know that physiotherapy is quite dogmatic practice. You see somebody and you do it. But that means that different physios are doing different things for the same condition or same type of patients, which is not really effective. So this is where we critically analyze the articles and the evidence to come onto conclusions as to what should be done and what should not be done, because that would be a waste of time if you do certain kind of treatments. And that bit is the difficult bit, because you tend to think that anything we can clinically reason is effective. But here, clinical reasoning is just one part of it. Evidence is probably the larger part of it. And that's where many of our international students find it quite challenging. And in terms of the other questions, Sam, do you want to remind me of the other question? I've completely forgotten about it.
Yeah, well, I know that the students get a lot of support on the course.
Yeah.
I wondered if you want to talk a bit about personal tutors and so on.
Thank you.
How can
Thank you for
students
that.
be helped at different stages of the project stage?
Absolutely. I think in terms of support system, we kind of pride ourselves with the personal tutoring system. When you join on the university, you are allocated a personal tutor. For example, I am personal tutor to 3 of the master students. So I'll be the first point of contact for these students for any of their queries. It doesn't have to be related to just academic queries. So the personal tutor kind of provides the pastoral care throughout your program. And essentially you can discuss with them anything and it would remain confidential. And our students kind of value that quite a lot, because every term they are meeting their personal tutors who kind of guide them through. The second type of support system that we have is an informal system where we are trialing budding students who have already done this program or who are alumni to the students who are currently joining. That's an innovative one, because I think you learn more from students than from teachers. That's what we feel. So if somebody has gone through the stages, they probably know much more about the program and the system than when you are joining. So for example, when Kokila comes in, she will discuss about how she may be able to support students later on. So that's another way of supporting. We have several others way of supporting with academic work within the university. If I discuss about those, it will take me a whole hour. So I'm just going to stop there. Coaching for academic English is one of the ones. We have got an international student support tutor who has joined this year with us. just to specifically deal with student queries, international student queries. So we have lots of support, but often it is up to the students to take this support. Although we are trying to provide the support more proactively, the onus would be on the student to take this support.
Thank you. And I think that's really good advice in my experience, that students need to come out and ask for some support. And it's the university's role to make sure that students feel comfortable to approach us for that support, and then they know who to turn to. But it's fantastic that there's a support system built into the program and get running throughout the program. And no doubt that's why our students can be so successful afterwards as well. I think it's a great time to bring in Kokila, because you already spoke about the benefits that students can get from learning from others who have already studied on the program and sharing their experience. So I'll pass over to yourself now, Smarak, to introduce us to Kokila and have that discussion.
That's great. Thank you very much, Sam. So I'll bring in Kokila. Kokila, if you can, yes, your video is already on. Thank you very much for joining us at a short notice. And let me introduce Kokila briefly, and then I'll let her introduce. Kokila Walia is our student on Masters in Advanced Physiotherapy program. And Kokila has completed all her modules. Is that correct, Kokila?
Yes, I've completed all my modules. Only the advanced project is going on, just a bit of it.
Okay, that's fine. So I guess that's slightly delayed because of the pandemic. Is that correct? Yeah, right. So Kokila joined us in September 2019, and she has gone through most of the modules. So she would be the best person to give the perspective of a student and to discuss about student experience. Kokila, I'll give you some time to introduce yourself and your background and what you did and how you joined Manchester Metropolitan University.
So I'm Kokila, as you said, and I'm from India. I did my bachelor's of physiotherapy from Ramaya Medical College, and then I went on doing one more degree from Canada in fitness and health promotion. Then I wanted to specialize further, and when I was going through the universities, because I wanted to come to UK and explore a different part in the world. So I saw Manchester Metropolitan coming quite up in the rank, and especially for physiotherapy, the facilities were very good because I had already studied in Canada, so I knew from, which place to compare it with. So it was equally good, and especially the teachers and the course information. If you go on the website, you will understand each and every part of it, like what is your interest. You can read about it, and if you have any queries, you can always mail them, and they will always help you out, and they'll always reply to you as soon as possible. So that's how I started my journey. And then out of all the colleges that I'd applied around 4 to 5 colleges. And the more I started understanding and going in depth about the colleges and understanding, I found Manchester Metropolitan to be one of the best for physiotherapy. That's the reason why I joined here.
That's great. Thank you, Kokila. So what attracted you to MAB in the first place? Was it the ranking or the choice of units, or what was it?
It was the ranking and as well as the choice of the units, because I wanted to, I was very confused between musculoskeletal and neuro. But when I started going through the course information, I saw there's like, even you can take subjects on conflict management, leadership. There's so many varieties. It's not that you have to be stuck to one particular subject. And that variety made me feel like, oh, I could try this. I could, try that one. So, and because of that, I saw in musculoskeletal also that options like manual therapy and musculoskeletal medicine. So that's what attracted me, and that's the reason why I took majorly all the musculoskeletal subjects and other subjects as well to be more versatile in during the practice time.
Yeah. So Kokila, I know it's been almost a year and a half since you were interviewed. If you remember anything at all about the interview process, that would be great.
Oh yeah. So you had taken my interview actually.
Right.
So Yeah, basically, we had interview time fixed on the Skype, and you had asked me questions about like the basics of research, which I guess in India during our bachelor's time we do learn, not a massive amount the way we learn here, but just the basics of it. And then, yeah, those were the question and generic question like what did I study, where did I study, all the stuff. So it was a good interview, like.
Yeah. So I must say, I mean, if you think about the interview and you think that they're selecting us, it can be a bit daunting. But I suggest all the students who go through to the interview stage to think of it as an informal talk discussion. The kind of questions you might be asked would be around your clinical experience. There may be a scenario that is given to you, and you basically have to tell what would be your management or assessment process with some sort of evidence. And you need to discuss about your research methods. We are keen on that aspect, and many of the Indian students kind of falter on that area because they have not done any research. But even if you have not done any research, it's still not the end of it, because then we'd be asking about your generic knowledge about research. For example, what do you mean by a randomized controlled trial, a quasi-experimental study? So those kind of details. A lot of students get a little bit flustered about the interview. There is no need to be, because it is very informal and very friendly. Would you agree with that, Kokila? When I'm putting a word in your mouth.
Because initially even I was very scared. I was thinking like how it might go, but when I started talking with you and like it was around after some time I felt like, oh no, this was comparatively comfortable and easy, you know. It was not like very daunting to me. So after the interview was done, I went to my parents and I told them, no, it was very, you know, like calm and nice. It was not a part where I need to be so scared or, you know, like be flustered.
Okay. Sorry, Kokila, to put you on the spot, because I know it's been 1.5 years and we don't remember everything that goes on, because that's done and dusted. So let's move on to the next bit, which is about your experience on the program. Do you want to tell us briefly about your experience, general experience, given that it has been affected by COVID?
So my experience initially was in the university itself. We used to have classes. I had subjects where I had practicals as well. So we used to go for the practical classes, for the theoretical classes. It was good. And then the COVID hit. After that, also, I would say our teachers, our professors tried their best to teach us online, because I had two courses which was held online, and I did feel that they tried their best, and I did learn. It was not much of a difference. Obviously, in person, it's a bit different, but online, it was, I would say, like at least 80 to 90% of what we could learn in classes, it was similar, because everybody was there and they made sure it is very interactive, you know. They would ask us questions, and if we had any problem we could always ask them without feeling scared or, you know, being shy, because out here all the professors are very friendly, so you can like take them as friends, talk with them, and they'll always give you a answer back with a smile, so you can never worry about questioning here.
Uh, Thank you. So what do you say about the teaching methods on the unit? Is it any different from India?
Yeah, it is very different. In India, it is we study theory and practical as well, but it's not so much of evidence and literature. Here, everything is evidence based. So even if you want to write, like you get assignments, so everything has to be evidence based. You have to look into the research of what has been done. And as it is, physiotherapy is mainly evidence based. So what we are learning here will help us in our future practice whenever we pick up a certain kind of manipulation or certain kind of technique. So we now know how to go and read and how to understand the research and apply it.
Right. So the next question is about your experience of assessment, because that's one area where we are very different, I think, from India. So do you
Yeah.
want to tell about that aspect?
So assessment can be like, as I said, theoretical and practical, depends on the subject you have taken. And practical is very hands-on. You and the class, like every student are practicing on each other. And then theoretical, as I said, that they will give you a case and in which you have to understand the case. It can be a management or a diagnosis, and then you have to go research about it, read articles, do the literature review, then critique it. Critiquing is very important out here. So it is very different than India. You get to learn a lot of things which will be applicable, and you'll understand much better if you want to work in UK also later on. So this will be the foundation for you, a base for you to understand how it functions in a different country.
Great. Just to add to what Kokila said in terms of assessment, we have got varieties of assessments depending upon your module. Some modules will have assignments to write, some will have presentations, some will have practicals, some will have group presentations. So you will find an entire range, and that kind of is very good, because if you're not great at writing, you can do well in practical, well in presentation. So we kind of provide the opportunity for different learning styles to perform well in our program. So that's a good one. So let's move on to the next bit. Tell us about your experience of practical sessions. Are they similar to India?
It is somewhat similar, yet not similar, because in India we do practice on each other in the classes, and here also we do the same. But I feel like it is more interactive here. So even if we are doing a particular test, for example, so the teacher will give us, two, three people groups will be set where we will get a particular test, and then we have to go online and see the literature for it. And when we are practicing those tests on each other, that ways we know the evidence also behind it. We have seen the research also. Now we are not at 50-60% of what we are doing. Now we know, like, it's 100%. Like if somebody will question us some other day, like, how do you know this test does work? So now we have the evidence to back it up. That's how I feel.
So Kokila, how did you find the writing bit, particularly critical appraisal and synthesis?
Okay, so the writing initially it is difficult, I would say, especially for students coming from India, because they don't have experience as such. But we do have a team to help us, like be it English, be it even in the library. There'll be people to guide you how to reference things, how to learn how to use the articles. So the help and support is always there. It is up to you how you would use it, or you want to use it or you don't want to use it. But and along with that, there are like guides. You get tutors, so personal tutors who will always be there. You can always mail them and they'll always reply it back to you. So initially it will be hard, but by the end of the year, I'm sure like all of you will be a expert in it. You'll learn your way through.
That's great. Final question. What are your 3 key suggestions about studying abroad and coming to the UK?
I would say, like, when you come here, it is a very big opportunity given to you from your parents, because they are putting in so much of work, and for your professional growth as well. So utilize it. Do not waste it. It is a very big opportunity to learn lots of new things that you might not learn otherwise. So use it to the best. Be positive. I know the situation in the world right now is not right, but all we can do is stay positive and try to focus on the right direction. That and just have a good time as well when you're here. Like try your best to balance it out.
Yeah. Well, I forgot about one of the questions, which is probably going to be quite important for many of the students. It's about working while studying. Did you work while studying, or?
No, actually, as soon as I had come, I just took some time to settle in, and the pandemic hit. So after that, I didn't think it was safe enough to work. So I didn't. I don't have that experience.
That's perfectly fine. But you have applied for HCPC, haven't you? Or
Yes.
you're in the process of applying? Yeah. So I think this is going to be an important bit. So Sam, do you want me to explain about the HCPC process?
Yes, that was going to be pretty much my first question, because I know that viewers are going to be thinking of the investment that a postgraduate study in the UK represents, and thinking about what can come up the other end of that study in terms of employment, and particularly interesting to know about working in the UK as one option. So I was going to ask, what are the things, what are the accreditations, what are the different things that students might need to know about that they need to receive before they can work in the UK afterwards? So I know HCPC, I hear this a lot. So what is HCPC exactly?
Well, a lot of professions in the UK are controlled by councils, and physiotherapy is one of the protected terms. You can't call yourself a physiotherapist just because you're qualified in another country as a physio. So essentially, your regulatory body is called the HCPC, or Healthcare Professions Council, and the Healthcare Profession Council registers home trained students, for example, students trained in the UK, as well as students or as well as applicants who have trained abroad. And to work here, you need to be registered with them. And in order to get registration, you have to apply to them. Now, I have seen students applying from India. I've seen students applying after joining on the master's program. My general advice would be that you can collect all the documents required. You can download the form from HCPC website, but I would suggest to come to the UK to experience the system, because there are so many differences. In India, we emphasize a lot on clinical reasoning and practical skills. Here it is important, but I think even more important would be things like taking proper consent, communication, teamwork. So these aspects are not so much emphasized in terms of competency level in India. So if you just kind of write about the patients you have seen, probably your application will be rejected because you're not ticking all the boxes. Now, when you join Manchester Metropolitan University, although we are not directly related to HCPC at all, but we are experienced enough in terms of guiding students as to what they should and should not do. Ultimately, the decision is with HCPC to decide whether your application is adequate or they want something else in terms of evidence, or they want to outrightly reject you. But we have supported many of our students, and majority of international students from India tend to get HCPC registration without any problems. Some students tend to get a request for providing additional support. I would suggest discuss with your personal tutor. If they don't know enough about it, I'm always there. I can help you with that. But wait until you join, because then you can experience the system a little bit more. The other thing is we have an on-site clinic. So when you go there and work with Chris McCarthy in the on-site clinic, you get to know the difference in terms of practice. And that is a very good way of understanding what you should put in your application as well.
Thank you for explaining that, Smarak. I should say a huge thank you to our student Kokila. That was so interesting and insightful, and I'm sure viewers found that really, really useful. So thank you, Kokila. And one question that students might be asking, so they're thinking of different physiotherapy schools around the world, and you've talked about how we could support with HCPC and how that's necessary if you want to work in the UK after your studies. With the UK government's graduate route, which was announced last October and would be effective for anybody joining your programs this year or next year, students can now stay for 2 years after their studies as a minimum and could work in the UK. So could you say something about how is the graduate placement record at Manchester Metropolitan University?
Oh, absolutely. I mean, I know the GIR has come for this cohort, not for the previous cohort, but I must say many of our students who were not within the graduate immigration route managed to get jobs. So, for example, in 2017, most of our students managed to get jobs in the UK, particularly in the private sector. Then some of them have jumped into the National Health Services, which is the more sought after sort of career, because they have a career trajectory. Would it be worth showing the space spine at this stage, Sam?
Yes, perfect. Yes, if you have a slide, that would be helpful.
Yeah, let me just
So
show,
yes,
because that
National
will
Health
put into
Service.
perspective.
I know it well, but would you like to say a bit about what is National Health Service?
Yes, definitely. So if I may just quickly go to that slide. Yeah. So National Health Service is the major health service provider in the UK, and it's the equivalent of government service in India in the health sector. But I think about 95% of healthcare is provided by National Health Service. There are different trusts within the whole of UK, and but each of them are a part of the NHS. I think NHS is the third largest employer in the world. I think after Chinese military and something else in the US. Can't remember that exactly, but essentially in the UK, everybody prides themselves about their National Health Service system. So if you are a physiotherapist and if you join on the National Health Service, you start your, after undergraduation, you generally start at this level, band 5. So it's the pay is fine, and there are different bands, as you can see: band 5, band 6, band 7, and band 8. And the salary starts from 24,000 pound, and this is revised every year according to the inflation. So if you have got some years of experience, let's say 3 to 4 years experience, then you can apply for another job in band 6, which kind of takes you to that point. Let's say that you are applying a job at 26,970, but you get a band 6 job, you'll start at 31,000 something. And then you carry on every year. So every year there is increment. So you're not stuck at one place. You're going through the career ladder. Then you can apply for a band 7 job, and career progression happens like that. Some people get into band 8, which is highly specialized. I would say if you have completed a master's program from the UK, it is likely that you will join in band 5, because they don't usually count the experience in India or elsewhere. When you apply for NHS job, they count the experience in the NHS. But I have seen some lucky students have straight away gone and joined on band 6 salaries. Now it all depends. It's all depends on how you put forth your application and how is your interview. And if they think that you can perform at that level, they'll take you there. But generally speaking, your first career step would not be in the NHS. It would probably in the private sector, which provides mostly musculoskeletal outpatient treatment. What is happening now is in the NHS, many of the musculoskeletal outpatient departments have been outsourced to different companies providing it. And these companies will kind of offer you similar salary, but they will be taking some of these projects from NHS. So you'll be essentially working many times for the NHS, but not being a part of NHS. But once you have gained some experience, you can always make the jump. And GIR is fantastic in that sense, because you will have that initial experience, and then you can have the opportunity to join in the NHS after having some experience, which was not there for previous cohorts. So our students have been successful. I must say that this year, many of the students who joined on the private sector had to be furloughed, which is a scheme that the government is offering at the moment, where if you're not able to work, 80% of your salary will be paid. And some of them were made redundant because of the COVID situation, because many patients were not coming to the outpatients department. But I must say some of the outpatient department have gone online and they're providing, and some of our students are still in job. But once the situation of COVID improves, I think that the situation with recruitment will also get better. With the vaccine around the corner, I think it's only going to be brighter than now. What has happened this year is not expected. It's probably a blip rather than the norm. Normally speaking, 80% of our students who want to stay in the UK tend to stay in the UK with a job.
Thank you, Smarik. And I should say this session, it is in November 2020, when many students may be joining in September 2021 or January 2022. We're very hopeful that things may look very different and more similar to what we're accustomed to from our previous batches of graduates. But that graduate route being there, I think that makes that detailed information about the NHS points really more useful for the viewers. And you also said that our graduates often go into private practice first rather than directly into NHS as well. Could you explain a bit more about why that is? Why not go straight into the NHS?
Yes, first of all, private companies like international students. There is a reason why they like international students, because when you are with them, you kind of stick to them for longer. Over here, if you think about home graduates from the UK, they tend to look for a career progression pretty fast, so they are zigzagging all the time. Because of the visa restrictions, you probably would not be moving as much, and for private companies, that stability with respect to their staff number is quite critical. So that's why they're very keen on taking international student graduates on visa. But again, the issue is that NHS values NHS experience. Okay, so if you do not have any NHS experience, because you have not had an undergraduate program here, because our undergraduate program students go out into NHS to have their experience. But because you don't have it, they're a bit reluctant to take you straight away. But once you can demonstrate that you have actually treated patients of NHS, although being in a private company, that builds your experience within the UK. That UK experience is quite critical to get a job, particularly within the NHS.
Thank you very much. It's really interesting. And I guess one question students will want to know is, okay, I've picked a well-respected course. I've got the right combination of skills that will help me in my chosen path. What else could I possibly be doing to boost my prospects to land a job after I graduate from the course? Is there anything else you could tell them?
Absolutely. First and foremost is writing your CV. It's your Indian CV is not going to work, to be frank. So in university, we provide support with CV writing. So you can go to them and you can refine it. And many of our students have found it quite interesting. Then the second thing, obviously, you have to have HCPC registration. And once you have got HCPC registration, then you have to be a member of Chartered Society of Physiotherapists. Here, professional indemnity insurance is very important. So say, for example, you do something that harms the patient for reasons that are beyond your control, you might be sued. And in that case, you have to have that insurance to protect you against any legal issues. So CSP provides, the Chartered Society of Physiotherapists in the UK provides that. So HCPC and CSP are absolutely vital. And then basically sort of applying to jobs, looking at their job specifications and person specifications. Each job will have some well-defined criteria as to what your roles will be, and how you demonstrate that you match them is going to be absolutely critical. And that's done through your personal statement. Many of the Indian students would not know how to write a personal statement that will land them a job in the UK. But we can help you with that kind of aspect, because most of the staff would be experienced in applying for jobs and getting jobs here.
Thank you. And the class time, will that fill the whole week, or is there any independent learning time? And do you notice a difference in the success of students based on how they perhaps use that time most wisely?
I think that's a very good question. One of the critical differences in terms of program format between a master's program in the UK and in India is that our units are all modular. That means we run the units and then the assessment in probably 5 to 6 weeks time. Now, 5 to 6 weeks time doesn't mean that every day of the week for a unit. It's going to be 1 day per week, and about 5 weeks, then 1 week of assessment. So in 6 weeks, a whole unit is completed, but you're talking about 6 definitive days. So it all depends on how many units are running at that point of time. For example, if you have 3 units running, you'll be busy for 3 days. And that's pretty much the maximum I would suggest in one term, because you are not just doing your face-to-face learning or online learning, you're also supposed to do a lot of homework. About 70% of the work you do on the master's program is self-study, research, analysis, and writing up. So at any moment of time, I think you would be in the university maximum for 3 days. But that doesn't mean that the rest 3 days are for working or rest 3 days are for enjoying, because that's probably going to be filled in very quickly with your work you have to do.
Thank you very much. And you mentioned there about working when you're not in class or studying. So is part-time work, is that something that you would allow? I know COVID has made things a bit uncertain at the time of recording this session, but in general, do some of your students work part-time? Is that allowed?
Yes, absolutely. I think the UK government allows 20 hours per week during term time and full-time work during the times when the university is closed. So that's the government rule, and you're allowed to work anywhere as long as you have got a job. You should be fine. Many of our students before HCPC tend to work in different sectors, not necessarily physiotherapy or health sector, just to support themselves during the program. But once they have HCPC registration and CSP, they tend to take work in physio because it pays much better. I mean, almost twice as much as basic jobs. The other thing is that you can also do what is called a jobs for students in the university, and that basically allows you opportunity to work for the university, but the university pays you. And one of our very popular jobs for university jobs, so to speak, is working in the clinic um, as a physiotherapist after your HCPC, because that's a safe environment to work where the university pays you, but you're learning at the same time as well.
Thank you very much. So we will bring in Prachi from our India team shortly just to answer some of the practical questions. And we may pick up some other questions that viewers of the live session have for us as well. But I just wanted to ask you a couple of final questions, if I may, Smarak. One of those would be, what are you looking for when you're assessing an application, students applying from India? What are the sort of things that you're looking at when you're deciding who to award the seat to?
Yeah. The entry criteria for Masters in Advanced Physiotherapy and Sports and Exercise Medicine are slightly different. The first one, the Advanced Physiotherapy program, we are generally looking for students who have graduated. We encourage recent graduates, that's not a problem, but if you have got any experience post-qualification, that's highly valued. The initial scrutiny of the application is done entirely by the admissions team. We are not a part of it quite deliberately because we don't want to influence that process. You need to have at least a 2.2 or above, which is about above 60% in terms of Indian grade. So in your graduation, you should have scored above 60% to be a part of it. We realize that some of the Indian institutes are very harsh on giving marks, but they're top quality universities. We can make some sort of concessions with those universities, but generally speaking, 60%. And then the interview stage. In the interview, I'm looking for your communication skills. I'm looking for the reasons for applying to this particular university. I'm looking for your clinical experience, your research knowledge, and your ability to learn by yourself. So these are the 5 criteria we assess you on, and it's pretty transparent. So by the end of the interview, I would be able to tell you whether I'm happy to accept you on the program or not informally.
Thank you. So we will come back to you shortly, Smarak, with some other questions, no doubt, but I'll turn now, if I may, to Prachi. And Prachi, would you like to quickly introduce yourself? And also, if you could tell us a bit about, we've talked there about the criteria for landing a seat on the program. How is the criteria for scholarships? And can you tell us a bit more about the scholarships? And what are the practical next steps you would encourage somebody watching this session? What should they do if they're interested or if they have any further questions?
Sure. Thank you, Sam. I'll start with my introduction. So, hello everyone. My name is Prachi. I am the India team manager. Me and my team here are here to support you at every step and way when you are making your application for our university. The process basically begins when you have looked up the course on a website, you are interested, and you wish to make an application. You can visit on the course on our website and move further from there by clicking on how to apply, and it will take you further onto the application process. Once you are through with the application process, and as Samarak already mentioned about the interview being one of the criteria for selection, the next step that might occur to you is, if I am selected, what are the kind of bursaries or scholarships I may get. So there are different kind of scholarships that we offer, but some of the related ones I will say right now. First is our international student scholarship, which is the international postgraduate and undergraduate scholarship. These are the scholarships based on your nationality and the grades you've achieved in your previous qualification. It can range up to £2,500 for postgraduate, and for undergraduate, it will be £2,000 each year. In addition to this, we have an academic scholarship, which is known as the Vice Chancellor Scholarship. The Vice Chancellor Scholarship is for £5,000, a bit competitive, but it's not that hard to get if you have always had a good profile and you've explained that very well in your application, because Vice Chancellor Scholarship requires an detailed application form on its own, which is again there on our website. For more details, like I said earlier, you can always get in touch with our team in India. You can contact them on the email ID india@mmu.ac.uk. Also, if you're looking for a free presentation, especially on the topics that we have discussed during our session right now, feel free to drop us an email on this email ID and we will be sending that over to you. Uh, this is primarily about the application process and scholarship, Sam. I'll quickly touch base on some of the benefits that maybe Indian students will be keen to know. We've talked a lot.
Yes, please. Any questions you think would be interesting? Yes, please. If you could speak a bit on that, Prachi, that would be great.
I was overhearing how very good questions were brought up about what kind of practical support our university provides our students, or the kind of benefits UK government is offering to international students. So one of the best features which has been relaunched in UK is the graduate immigration route. In case you are not familiar with the term, I'll just quickly break down the jargon. So, graduate immigration route is basically the 2 years stay back option, which has been relaunched in UK now. And the moment you are done with your degree, for example, your master's physiotherapy degree will be for 15 months. So, your visa will be allotted to you for 15 plus 4 months addition. So, your overall visa duration will be for 19 months. Now, the moment you are in the remaining 4 months, you can apply for the extension of 2 more years by applying for this graduate immigration route visa. And we will also be, of course, there to assist you if you require any help, but it's quite simple, to be honest. And once you've applied for it and you've been given the additional 2 more years to stay back, in those 2 years, we at Manchester Met have an early careers team, which is a very unique concept we are offering to support our students. And that early careers team members will actually help you grab the best career opportunity during those 2 years when you are staying back to look up for your career. In addition to that, we also have a scheme wherein we help you for your career placements throughout your lifetime with the help of our alumni network, which is another unique factor that I can confidently say that our university is actually offering. So these are some of the quick things I could talk about. And Sam, I think if you feel that's all, or should I emphasize on
Thank you. No,
anything else?
that's fantastic. So, yeah, viewers, check out our website, see the course information, see the course detail, and then keep your questions coming to us. And you can do that through Prachi's team, india@mmu.ac.uk. Join our Facebook, join our LinkedIn, follow the news. Thank you, Prachi, and thank you to Kokila, our student as well, and especially thank you to Dr. Smarak Mishra today. And I should also thank SI UK, who've organised today's session. And I know SI UK are a fantastic organisation who can support students who are at a point in their journey when they're thinking about overseas study and they need some professional advice and they need some support about the visa practicalities. And SI UK could give you all the different options in the UK, not just Manchester Metropolitan University, with some fantastic universities in the UK. So definitely recommend you to also get in touch with SI UK, and they can give you some free consultancy for our university, as well as letting you look around and see what the different options are for you. We know what a big investment it is for you, your time and energy and your money as well, and you want to get that choice correct for you. So everybody's situation is different, so SI UK can talk to you and find out what are the best options and then help you with some of the practical steps. But if you're looking at Manchester Metropolitan University, you've made a great choice, and you've also got that option to get in touch with us through our India team. And during the admissions journey, you would be having an interview with Dr. Smarak Mishra or his colleagues, and that will begin your support to getting the right program for you. I think at this stage, we may have some questions from the viewers. Bhavna, if you're around and have some questions, our panel would be happy to answer those at this stage. But if not, you can contact us if you're watching this through our email, india@mmu.ac.uk, including to get that free presentation that Prachi mentioned, which includes details about studying at the university, as well as what you can do afterwards. So those NHS PACE spine points and different practical steps to boost your employment opportunities in the UK.
Yeah. Thank you, Sam.
Thank you.
So moving towards the question and answer session. The first question, I'm pursuing bachelor's in physical education and sports from Guru Nanak Dev University, India, planning to pursue MSc Physiotherapy pre-registered.
Okay, shall I answer that, Sam?
Okay, I don't think I heard a question there, but I guess the question is, would somebody with this background be eligible? That would be a question for Dr. Mishra.
Yeah, so if you're studying sports and exercise science, then you would not be eligible for the Masters in Advanced Physiotherapy or Sports and Exercise Medicine program, but you can do what is called as Masters in Masters in Physiotherapy, but it is referred to as the pre-registration. So essentially, it is a 2-year accelerated master's program where you will learn everything from the basics of physiotherapy, taking you to a qualification of a master's level. Yes, you can certainly do that from a university, but you will have to apply for Masters in Physiotherapy pre-reg.
Fantastic. And that's a 2-year program. So that's the same duration as a typical master's program in India. Actually, the MSc Advanced Physiotherapy is 15 months, if I'm not mistaken. So that's a shorter time than students would expect in US or in India, for example. Do you want to just mention why is there this difference between the masters in India is 2 years, but in UK is 15 months?
Yeah, I mean, many students ask me that question. I think traditionally, most of the master's program in the UK has been 1 year. So we are offering 15 months because we think physiotherapy is more intensive than those programs. It's not, to be honest, a master's level program is not about the volume of knowledge you gain. It's about the quality and ability to learn by yourself. And we think we make our students ready within that frame of time to be effective at finding the right information and using it in their own practice. And that's the reason we can kind of justify a high level program within 15 months. And you will have the basics anyway with an undergraduate program. So we're building on what you already have.
Thank you. Next question. Can I enroll in physiotherapy master's program with an undergraduate degree without work experience?
Yes, you can. So essentially, we expect you to have some clinical experience, but we realize if you are doing an undergraduate program, 6 months of that program in India is internship. and within that time you would be independently practicing. So we value that experience. So even though you don't have 2 years post qualification experience, which is desirable, we still are happy to take you on MSc Advanced Physiotherapy program if you qualify in the interview stage. With sports and exercise medicine, though, we are very strict with our entry criteria. With MSc Sports and Exercise Medicine, 2 years of post qualification experience with some experience in sports is needed. So without that, we can take you on the program.
Thank you. The next question. What are the career opportunities during the course? Part-time jobs?
Well, as I mentioned, you're allowed 20 hours a week in terms of work during term time. Within that time, the onus is on the student to find the job, particularly because you would not be able to work as a physiotherapist prior to your HCPC registration. So our university helps you with opportunities within the university, and helps you with your CV and other aspects that are important for getting a job outside. Particularly many of our students at this point of time who do not have HCPC registration tend to go and work in the post office, because there are lots of jobs available, temporary jobs available for Christmas at this point of time. Many go into the retail sector, but as you know, currently with the COVID situation, retail is affected. So the opportunities might be slightly limited in the current COVID situation. We are speaking in 2020 November, but as things change with the vaccine, the opportunities are always there. Manchester being a big city, you will have plenty of opportunity to apply for jobs elsewhere.
Thank you. The next question. What are average grad salary upon completing physiotherapy course?
Well, the average graduate salary usually is the starting point, the band 5 that I showed in the presentation, which is about, if I'm correct, 26,000 pounds, starting 26,000 pounds. But you can always Google NHS bands, and the band 5 is the starting salary for physiotherapists. But you can work in band 5 or band 6, depending upon your prior experience, if NHS accepts you onto the role.
Thank you. The next question. What would be my opportunities with regards to working in the UK? Would I need to clear PLAB or any external exam to practice?
No, PLAB is for doctors. If you're a doctor asking this question, then probably yes, you have to do PLAB. For physiotherapist, you need to apply for HCPC registration as an international applicant, and if they are happy with your application, they will give you the registration. Otherwise, they might ask for additional information. But if the application is poorly done, they might as well reject your application. So you have to be very cautious about what you put in your application. But if you are a doctor, PLAB is the way. And myself not being from medical sort of fraternity in terms of not being a medic, I would not be able to advise you about that.
Thank you. The next question. Are there scholarships available for Jan intake? What is the deadline?
Well, for January intake, I must say this is a sticking point. I would say you are pretty much well past it. If you apply for it now, it's highly unlikely that your application would be processed before December, because of the backlog in the system we have. That means you can't make it to the UK by 20th of December, which is the deadline for arrival. So I think if you are planning to apply, it is too late for January intake. You would be looking at September intake.
Thank you. The next question. What are international scholarships?
Prachi, would you answer that, please?
Prachi, would you like to say more on the scholarships? I think you introduced these before.
Sure. There are different kinds of scholarships. I have tried to put the link as well in the comment box here under the live streaming section. The first is the International Postgraduate Scholarship that you can look for, which is up to £2,500. And the other one is the Vice Chancellor Scholarship, which is for £5,000.
Thank you. Yeah. The next question. As of now, lockdown is going on in UK. How uni is planning to start the program in January?
That's a very good question, I would say. In January, the plan is that we run with our face-to-face face session, but with all the precautions that are required. So in the UK, the norm is if you have got personal protective equipment, which includes a visor, the mask, and the apron, you can do work face-to-face as with practical sessions. We have been running these sessions even in the lockdown, current lockdown, and because we have taken all precautions, it's quite possible that we'll be continuing with the same. I think January will remain like that, and I envisage that February would be similar. But as the vaccine kind of is rolled out, things might change. So it's a bit uncertain, but our face-to-face sessions will run. I can assure you that.
Thank you. The next question: is there any prerequisite of work if I do not have relevant background in science or my borderline grades?
Well, yes, of course, we have got prerequisites for masters in advanced physiotherapy and sports and exercise medicine. You have to be a graduate physiotherapist to do either of these. For sports medicine, you can be a doctor as well as an osteopath, which is not a common profession in India, by the way. So without those, you can't get onto the masters in advanced physio or sports and exercise medicine. But if you have got a background in sports and exercise science, sports psychology, and that kind of area, or sports therapy, that kind of area, you can do what is called as pre-reg master's program. And that's a 2-year full-time master's program. Borderline grades, I'm not certain what you mean by that. With borderline grades, let's say that you don't have 60%, we'll still sort of look at your general experience, look at your personal statement, and make a decision based on that. But if it is well below, let's say 55%, it might be difficult to consider you.
Thank you. The other question is also like that only. Sir, commerce background student can do physiotherapy course. So I think you have answered.
No, you would not be. You will have to be from a related area to go into the pre-reg program, or if you have got a physiotherapy degree, you can go on to a master's post-reg program.
Thank you. The next question. Physiotherapy didn't come in the shortage list of occupations. Will Indian students get tier 2 jobs in the NHS?
Well, the shortage list, I don't think physiotherapy is in the shortage list at the moment. But don't quote me on that. You will have to look it up yourself. So tier 2 jobs, I think because of the GIR, the situation is going to be different because you would be in a different visa. And within this process, if you find a sponsor that sponsors your tier 2 visa, that's absolutely fine. That's what our students without the GIR have done. So they got a job, then the job kind of provided them with the tier 2 visa, and they're continuing there. So that is always a possibility. But for you, because there is GIR, the situation would be slightly different. In fact, better than the previous cohorts.
Thank you. The next question. Can student work as assistant physiotherapist while studying masters or before HCPC registration?
Well, again, a very good question. Here we have got jobs such as rehabilitation assistants, physiotherapy assistants. Then I am forgetting other terminologies within the NHS. You don't require to have a formal qualification as long as you are qualified at the NVQ level, which is similar to a 10+2 level in India. So yes, theoretically, yes, you can do it. The only problem is that many of these positions are full-time positions. So you are expected to work the full time, and when you're studying, you are not allowed to do it. So you can explore, but the chances and the scope of working as a physiotherapy assistant in this country is fairly low. So I would suggest to go down the HCPC route and get your HCPC registration as soon as possible after joining the program.
Thank you. The next question. Can you please explain in details a little more about how band 5 and band 6 are differentiated? Like, is it based on specialization or is it related with work experience?
It is generally related to work experience, but sometimes master's students can directly join on band 6 because they have specialized in one area. But the incidence of that kind of job offer is fairly low, I must say. So once you join in band 5, let's say in an MSK setup, because in UK, the band 5 could be of two types. One, you could do rotations where you join a trust, and within the trust, National Health Trust, you will be rotated in different departments such as musculoskeletal, neuro, cardiorespiratory, ICU, renal, etc. There are loads of departments. You're going to rotate for about 6 weeks to 3 months duration, and then you decide about your specialization. Once you think that you're ready for your specialization, even without a master's degree, you start applying for band 6 jobs. If you qualify for those band 6 jobs, they are generally based on not just the ability to do clinical work, but to lead others, to organize work, and to manage other people to a certain extent, not a lot. Clinical component being about 80% and 20% probably would be management responsibility. Then you can move up the level into band 6. Band 7 is more of management, where you would be dealing with like at least 10 or 15 different individuals. You will be line managing them. So the higher you go into these bands, the more management like job it is. But at the moment, there are specialized jobs called as advanced clinical practitioners, where physiotherapists can specialize in providing injections. Physiotherapists can sort of do first contact practice, where you can go into a very clinical job, but in band 8A, which is very highly paid.
Thank you. The next question. If an applicant has scored 59% in the bachelor, will they be considered for advanced physiotherapy course?
Yes, you will be, based on your experience and your personal statement. If you're borderline, generally the admission teams kind of consult us whether we are happy to interview you. The only issue is that if you have failed too many units, we will not be able to offer you an interview. So if you have not failed many units, but you are borderline, we'll probably take you through to the interview stage.
Thank you. The next question. Apart from core modules, how many modules can we choose from on our own?
Yes. So as I mentioned, in advanced physio, there would be 80 credits devoted to mandatory units, 20 credit of research methods, and 60 project. The rest would be essentially your options. Now, if you want to choose all 5 as options by picking and mixing from the different units available, you can do so. But if you go down a specific route, for example, musculoskeletal, then you have to do at least 3 of them in musculoskeletal. If you want to do in neuro, 3 of them has to be in neuro. But manual therapy, 4 of the units have to be around manual therapy. It's a bit complicated, but I must say, don't make hasty decision prior to joining on the program. Your program leader will have a thorough discussion with you to guide you with your choices.
Thank you. The next question. I am a graduate student with arts background and I'm looking to discontinue and take up in the UG in physiotherapy. Would you recommend any foundation option or a direct entry to UG?
Sorry, what is the qualification, basic qualification?
He has done arts studies in graduation, but he wants to discontinue and study graduation again in physiotherapy. So he wants your recommendation about the foundation course options or any direct entry for UG course.
So it all depends about on your 10 plus 2 subjects. If you don't have any science subjects, then it will be very hard to join on the advanced physiotherapy program. So in that case, you will have to do a foundation year, which is foundation in health and social care. You could do that from Manchester Metropolitan University or could be from other universities. If you pass that element, that kind of takes you to the level where we can accept your application, and then we can take you from there. So I think by the looks of things, you don't have any science subjects, which means that you will have to do a foundation year.
Thank you. The next question. I have 87.7% score with 2 international research papers, 3 months of work in a rehab center and studied bachelor's in physical education and sports from Indian University.
So what's the question?
I think he is asking that he is eligible
You
with.
would be eligible for the pre-reg master's program, not for the advanced physiotherapy program or sports and exercise medicine program.
Yeah, he is asking, is my profile good enough for MSc Physiotherapy?
Yes, that's what I meant. We have got MSc at physiotherapy pre-registration, which is open to non-physiotherapy graduates, but it's a 2-year full-time program. You can do that, you can apply for that, but you cannot do a post-reg physiotherapy, which is the advanced physio or or the sports and exercise medicine. Let me just clarify this because lots of questions are coming. So basically, when we say pre-reg, that means prior to the registration with HCPC, post-reg is after the registration with HCPC. That's the general kind of distinction. But here, I know many of the international students would not have HCPC but are physiotherapists. So in order to gain a qualification or gain a physiotherapy qualification within the UK, you have to do a degree first, be it undergraduate or be it postgraduate. Then you are qualifying as a physiotherapist. Then it is called pre-registration program. So we have a pre-registration undergraduate program, BSc Honors Physiotherapy, which is 3-year undergrad, or we have a pre-reg master's program, which is 2 years master's level program for somebody who has already got an undergraduate degree in a related field, but not in physiotherapy. But if you're a physiotherapist, apply for advanced physio or sports and exercise medicine. I hope that is clear.
Yeah, the same candidate is asking about this. Since I'm looking for MSc Physiotherapy pre-reg, can I get VC scholarship for both years of my study? I have good grades.
Prachi, you'll have to answer that. I'm not sure about that.
No worries. When you're applying for a pre-registration course or any course, the Vice Chancellor Scholarship is awarded only once. So that 5,000 GBP, which is 5,000 pounds, which are awarded to you, are awarded to you once. So that is your call, to be honest. Once it is funded in your student account, that you want to use it in the student tuition fees only, or you want to utilize and withdraw the amount, that's entirely your decision, to be honest. But that is awarded to you only once, and that too gets credited to you after you have started your first semester. So no, you can't actually have it twice, to answer your question.
And I would just add that at the time at which you're making your application, it's important to check the scholarships page on the website. There may be new scholarships there. The scholarships may be larger than they are today. We're talking about £5,000, but it's possible that the Vice Chancellor Scholarship may be larger. But it's important to check the latest information at the point at which you apply before you do your calculations.
Thank you. The next question, considering current situation, will Jan 2021 intake be more of on offline or online? And if offline, how many days a week approx? Thank you.
Yes, again, a good question. The answer to that would be it depends on the type of module you have selected. So if you have selected a highly theoretical module, the likelihood of that running face-to-face is less because it will then be mostly online. And we have got systems where we can replicate almost similar to face-to-face sessions without the risk. So, for example, creating breakout rooms, giving you tasks as we would do in face-to-face sessions. But if it is a practically oriented unit, you will still be able to do it with PPE, the personal protective equipments that university offers in all practical rooms.
Thank you. The next question, I think you have already explained this, but again, I'm mentioning this. Difference between MSc Physiotherapy pre-registration and MSc Advanced Physiotherapy. So, would you like to answer?
Well, I think I have answered it. If
Yeah, you have
yeah.
answered. Yeah, thank you. The next question, uh, what about the IELTS requirements if I have 70% marks in English in class 12 CBSE?
So Prachi from our India team might be best placed to answer this particular question. We do have a range of different English language qualifications we accept. IELTS is a very well-known test, but because we've been receiving lots of applications over many years from very fantastic candidates from India, we're familiar with local examination boards as well. So Prachi, could you give a bit more detail on this?
If you have IELTS already, then we will look at 6.5 bands overall with 5.5 in each. In addition to IELTS, we also accept TOEFL, or you can also apply for PTE. In current situation, considering how some of the examination centers are closed, we are also accepting some online exams like TOEFL IBT or ESOL. These are some of the exams that we are accepting right now, or IELTS indicator. In addition to these, like Sam mentioned, yes, we do actually give a lot of waivers to some of the central boards. So let's say you have studied from CBSE or ISC board in class 12 and you have achieved 70% and above in your class 12 English, then you can get a waiver for these English examinations. Or if you are from some really high ranked universities in India, example, Delhi, Mumbai, or Calcutta University, then also you are actually eligible for such kind of waivers. Thank you.
Thank you. The next question, can you just brief about MSK medicine, upper and lower? Do they cover all the upper and lower MSK conditions?
Well, we have different units in terms of upper and lower quadrant. So there is musculoskeletal medicine upper quadrant, musculoskeletal medicine lower quadrant, which is very much orthopedic medicine based, the CDX method, CDX approach. We also have upper and lower quadrant in manual therapy, which is mostly, I would say, Maitland based. So yes, we would be covering quite a range of conditions in them. But our units are not based around conditions or the number of conditions. Our units are based around cases. So you will go through cases, you will clinically reason, and you will come across literature and use it in evidence. And once you learn that process, you can apply that process to almost any condition in upper quadrant and lower quadrant. So that's the critical aspect. It's not the coverage. We're looking at how you can do it yourself for conditions that we may not have covered.
Thank you. The next question, fee for MSc, musculoskeleton, any experience required?
Again, as I said, musculoskeletal advanced physiotherapy, musculoskeletal is a route in advanced physiotherapy. The experience requirement is exactly the same, although we would like some post-qualification experience. We are not too hooked on this 2 years post-qualification experience. If you have done an internship and some post-qualification experience, that should be fine with us.
Thank you. The second last question, does Manchester Met University provide PhD courses?
Yes, it does. For that, I think you need to contact the post-reg department, and basically they can guide you through.
Thank you. The last question, after 4 years plus 6 months of internship, UG physiotherapy at university in India, can we apply for MSc Advanced Physiotherapy?
Yeah, the short answer is yes.
Okay, so we are over with the live chat questions. I will really thank all of you for joining today. Thank you so much for your time. If you guys wanna mention anything on the live video, please move forward.
Yeah, just wanted to thank Kokila for joining me in, and thank you, Sam, for your valuable sort of insight, and Prachi as well. That's it from my side. Guys, I'm in a bit of a rush because I've got another appointment, so I'll have to leave at this stage, if that's okay.
Sure.
Yeah, there's one question
For everyone
which I
to
just
watch and
got.
stay in touch with us through our India team, india@mmu.ac.uk. Check out the website, follow us on social media, and thanks to SRUK for arranging today. And they can definitely help you take forward your application to UK universities.
Thank you, Sam. I have one question from a student. So hope the student wants to ask, for manual therapy route, is it necessary to have HCPC license?
For manual therapy, it is a little different from the other routes. It's best if we have the details exactly of their background before we answer that question definitively. It's not always required, but it would depend on the particular circumstances. So that's a case where Dr. Mishra would need to speak to one of his specialised colleagues. So I would suggest that email is one that could come into india@ratemu.ac.uk. So the same email address, if anybody wants to receive the free presentation, including post-study work opportunities, just drop a mail to us at india@ratemu.ac.uk. Any questions to do with today's session can be answered.
Thank you so much, Sam, Prachi, Kokila, for joining us. So it was really a wonderful seminar today. So let's,
Thank you very much.
Yes, Prachi, if you want to say something.
No, just saying thank you so much for this great session, and it was really great to answer so many good questions, to be honest, from our students as well. So thank you everyone for joining us, and hope to stay in touch through our contact details. Thank you. Bye.